Hello, welcome to this NMC OSCE tutoring video. My name is Hannah. I'm a UK registered nurse, university lecturer, and I've been an NMC OSCE programme lead. And on this channel, I share my advice, support and teaching to help nurses self-study and prepare and pass their NMC OSCE exam. Please like, share and subscribe if you found my videos helpful. In this video, I'm going to do a read-through demonstration of the community assessment medication charts, the implementation station for the community assessment, which is normally a diabetic patient. Okay, going to start the station. I'm going to look at my briefing. So I've been asked to visit Erin Thomas at home, your community nurse working from Ho GP surgery. Please administer and complete the documentation of the 100 hours medications in a safe and professional manner. Okay, so I'm looking for those medications at 10 o'clock. So I'm going to ensure patient privacy and dignity. I'm going to decontaminate my hands using the World Health Organization 7 steps. So palm to palm, palm on back of hand, fingers interlaced, palm to palm, fingers interlaced, fingers interlocked, thumbs, fingertips, wrists, and allowed to dry. Going to introduce myself to the patient. So hello, Erin. My name's Hannah. I'm the community nurse working out of your GP surgery, and I've come here today to administer your 10 o'clock medications. Before I carry on though, I just want to check your identification. So can you tell me your name, date of birth and address? Okay, so I've got Erin Thomas, thank you. And I'm checking this against the medication chart, and the date of birth is the 26th of 9th, 1947, and I've got your address as 14 Newhouse Lane, Plymouth. So that's lovely, Erin. As we're in the community, there's no wristband, so I'm just checking that against my medication chart, and I can confirm that is correct. And Erin, have you got any allergies to any food, medication, latex, for example? Okay, so no known allergies, and I can see that is documented here on the medication chart as well. I can confirm you've got no allergies. So like I said, Erin, I've come here today to administer your medications for 10 o'clock. Once I've confirmed those and got those ready, I'll explain what each medication is for. But are you happy and do you give consent for me to get this ready? Okay, thank you. And before I look through the chart, I just want to know if you've got any pain at the moment, and would you like any analgesics if they are prescribed? Okay, no pain at the moment, that's good. And do you feel sick or nauseous? No, okay, that's great. And are you happy to swallow tablets? Okay, that's perfect, brilliant. So I'm just going to read through and confirm the medication chart first. So I'm going to read my front page. So I've got Erin Thomas, date of birth the 26th of the 9th, 1947, hospital number F40881991. Sorry, that's your NHS number, and the address is 14 Newhouse Lane, Plymouth. I've got a height of 1.8 metres and a weight of 95 kilograms, and your GP is Dr. Jarvis at Ho Surgery, Plymouth. I've got one prescription chart of one, so I've just got one prescription chart that I need to be aware of. So my prescriber's details here, I've got Dr. Johns with a GMC number of 15674, signature of Jim Johns, and the contact here is Plymouth Ho Surgery 667899. I've already checked the allergies and confirmed that this has also been signed by Dr. Johns with the same contact number 667899. That's completed today. And medication risk factors, I see we've just got your diabetes there. So on to my second page, I have Erin Thomas, date of birth 26th of the 9th, 1947, and address is 14 Newhouse Lane, Plymouth. I can confirm all the other details are correct. This is my non-medication codes. There's no medications prescribed on this page, so I'm going on to my next page. So I've got Erin Thomas, date of birth 26th of the 9th, 1947, address 14 Newhouse Lane, Plymouth. Okay, so I'm on to my community patient-specific directions. I'm just going to look at the time first here. Okay, so this is during my time. So I've got the date is today, the drug is losartan, the dose is 50 milligrams, the route is oral, the time is 100 hours, so it's during my time. Frequency is once a day, end date is ongoing, prescriber's name is Johns with the signature of J. Johns, and the date is today. So I can confirm this prescription is clear, valid, and legible, and I'm going to administer that medication. I know losartan is used for diabetic neuropathy, but also hypertension. So examiner, can you just confirm the patient's latest blood pressure for me? Okay, that's normal, so I'm happy to go ahead and prepare that medication. Next medication, so this is sertraline. So this has already been administered at 8 o'clock, so I'm not going to administer this medication. And my next medication, so again, the date is today and the drug is sertraline, but this is not due at my time, it's due at 6 o'clock this evening, so I'm not going to be administering this medication. I'm now on to my next prescription, which is for paracetamol. This is a PRN, so an as-required medication, and I've already assessed Erin, and she said she wasn't in any pain, so I'm not going to give this PRN as-required prescription of paracetamol. Moving on to my next page, I've got Erin Thomas, date of birth 26/9, 1947, address 14 Newhouse Lane, Plymouth. I'm on to my medication here. So this is during my time. Okay, so I've got the date is today, the drug is metformin, the dose is 500 milligrams, the route is oral, time is 1000 hours, frequency is BD, so twice a day, end date is ongoing, prescriber's name is Johns, J. Johns, and the date is today. So I can confirm this prescription is clear, valid, and legible. I might just want to confirm the latest blood glucose. So examiner, can you just ask the patient to confirm the most latest blood glucose? So I'm happy that within normal limits. I'm going to prepare this medication. The next prescription is for metformin, but this is due at 6 o'clock this evening, so it's not due at my time, so I'm not going to administer that. Next medication is today for zopiclone, but again, this is not due at my time. This is due at 10 o'clock this evening, so I'm not going to be administering that medication. Next medication is for today is glycoside. This has already been administered at 8 o'clock this morning, so I'm not going to administer this medication. I'm on to my next page, which is Erin Thomas, date of birth 26/9, 1947, address 14 Newhouse Lane, Plymouth. So again, I've got another dose of glycoside due today, but this is not due until 6 o'clock this evening, so I'm not going to administer that because it's not due at my time. Okay, so my next medication here, okay, this is due at my time, so I've got the date is today, the drug is nitrofurantoin, dose is 100 milligrams, route is oral, time is 10 o'clock, so it's due at my time, frequency is BD, end date is ongoing, prescriber's name is Johns, signature J. Johns, and date is today, so I can confirm this prescription is clear, valid, and legible, and I'm going to administer that medication. I've got another dose here of the same medication, nitrofurantoin. The dose is 100 milligrams, but it's not due at my time. It's due at 10 o'clock this evening, so I'm not going to administer this medication. There's no admitted medications. Okay, so I've identified my 3 medications I'm going to give. I'm going to decontaminate my hands using the World Health Organization 7 steps, and I'm going to go and prepare my medications. Okay, so my first medication here is losartan. The stock dose is 25 milligrams and expiry date is 02/29. And I've got prescribed losartan dose of 50 milligrams, so I'm going to administer 2 tablets. I'm going to put those into my pot and put that onto my tray. The next medication I've got prescribed is my metformin. So I've got metformin, the stock dose is 500 milligrams, the expiry is 04/27, and I've got prescribed metformin 500 milligrams, so I'm going to give 1 tablet. And my next medication is, okay, so I've got nitrofurantoin, the stock dose is 25 milligrams and expires 01/29, and the prescribed dose is 100 milligrams, so I'm going to get out 4 tablets. 3, 4. If I didn't know what these medications were, I'd be looking those up in the BNF. So for example, if I wasn't too sure what losartan is, I'm just going to have a look. So it's used for diabetic neuropathy, chronic heart failure, or hypertension. So I know my patient's diabetic and got hypertension, and 50 milligrams is the required dose. Side effects, abdominal pain, some diarrhea, dizziness, headache. Okay, and I'd look through my other medications if I wasn't clear on them. So maybe I might want to check my nitro butyrotin, so my antibiotic, which I know this is an antibiotic for UTI infections, and I know from the background the patient's recently been discharged from having a urinary tract infection. Okay, right. So I'm going to go back to my patient, decontaminate my hands on return to the patient using the World Health Organization 7 steps, and I'm going to confirm I'm back with the right patient. So hi, Erin, I'm back with your medications now. Can you just confirm your name and date of birth for me and address? Okay, thank you. So I've got Erin Thomas, 26th 9th, 1947, and address is 14 Newhouse Lane, Plymouth. So I'm back with the right patient. So Erin, I've got some water here if you would like it. And I've got your first drug, which is losartan. This is a antihypertensive medication and also can be used to treat your diabetic neuropathy. It might make you feel a little bit dizzy or lightheaded. But are you happy to take this one? Okay, thank you. Just confirm you swallowed that one for me. Brilliant. Your next medication is metformin. So you'll be aware this is used as part of your type 2 diabetes management to help control your blood glucose levels. Are you happy to take this one? It can sometimes make you feel a little bit sick or reduce your appetite. Okay, perfect. So just confirm you swallowed that one for me. Okay, and it's good you've taken that either directly before food or directly, with your food as well, and not on an empty stomach. And the next one here is your antibiotics. So this is your nitrofurantoin. This is your antibiotic because you've had that urinary tract infection. So this is just the end of that course of treatment for you. It might, again, sometimes antibiotics can give you a little bit of an upset stomach or some diarrhea, but are you happy to take this one? Okay, thank you. So can you confirm you swallowed that one for me? Brilliant. So I'm just going to do my documentation, Erin, and then I'll be back. Okay, so I'm just going to do my documentation, Erin, and then I'll be back to just check how you're doing. So I'm just going to put my signature. The date is today, and the time I've given these medications is 10 o'clock. So remember, with our community charts, we need to write the date, our signature, and the time. So that's my metformin. I'm also going to sign for my, oh, sorry, that was my antibiotic. I'm going to sign for my metformin here. Again, 10 o'clock. And I'm going to go up and sign for my losartan. And I need to complete the front page as well. So I'm going to put my full name in here, my initials, my signature, so how I've signed for those drugs on the front, and the base is where I'm working from, and this is the GP surgery as per my briefing. So I'm just going to go back to the patient now. So Erin, I've given all your medications. As it's the community, I'm just going to wait for 30 minutes just to make sure you don't have any adverse reactions to those medications. After I've left, if you have any issues or concerns, you can call your GP, NHS 111, or if it's an emergency, you can ring 999 for an ambulance. Okay, and I'm just going to finish up my station now with my final hand hygiene following the World Health Organization 7 steps. Hope that video was helpful for you. So to crack the implementation station, you need to be really familiar with your medication charts. You need to be able to confidently identify when medications are due at your time, when they're not due at your time, any contraindications on why you wouldn't give a medication. You need to safely and correctly verbalize and confirm those prescriptions are valid and that they are safe to give and they meet all the requirements for a legal prescription. You need to dispense your medications correctly and you need to explain them to the patient so they understand what those medications are for, to make informed consent, and then get your documentation complete correctly, which is absolutely essential.